The next video we're about to watch is titled Virtue Signaling, Community Service, and Servant Leadership. Virtue signaling is this pejorative term that was used for elites who, through certain kinds of community service, volunteering, and fundraising, signal that they're a certain type of citizen, they're a certain type of human being, they're a certain kind of moral agent. And it was meant in a sort of snarky, condescending way. But I, being as I am, thinks that this term actually exposes or illuminates the admissions process and the expectations for pre-health students in terms of entering a social contract in healthcare and caring for society in which they are a servant, a public servant of sorts, even though they may work for a private institution, and that how they engage with service prior to becoming a professional will foreshadow the kind of professional that they will be. Say, for example, we have students that who volunteer at the Bailey Boucher House, which is the first AIDS hospice in the United States. It requires a year-long commitment. It requires students to show up every week for a certain amount of time. And it requires them to work with a very marginalized population. Now, this population isn't as large as it used to be in terms of how they end up in hospice and because of these antiretroviral cocktails. But nevertheless, when a student is working with whether it be LGBTQI population infected with AIDS or immigrant populations who are being affected by the lack of having, being naturalized, for lack of a better phrase, for having citizenship, or poor kids who are involved in a poorly resourced urban education, it signals to committees the kind of citizen they are. Now, you could think about that in sort of Machiavellian terms as being, very, you could read it in suspicious terms, and that the candidate is trying to manipulate the committee. But there's another way in which if you know this, it can help you think about and reflect upon what are the real moral implications for working with these populations, and how, in working with these very marginalized populations, it can illuminate one's own class, privilege, but also the kind of heart and affect and compassion and empathy that we expect people in healthcare to have developed before they enter professional school.
We've all seen pictures on Instagram or other social media of students out volunteering. It may be a picture before a fundraising race or at a clinic. While it may seem harmless or even helpful to raise awareness for the particular cause, there's an underlying issue at play. If you are volunteering to make yourself seem kind, is it really an act of kindness? Or do you need to sacrifice in order for it to truly be an act of service? Is selfie activism really supporting a cause or hurting it? This leads us to virtue signaling, which is defined as the way in which many people write or say things to make it seem as though they are virtuous. Virtue can be a political cause, volunteer participation, or a moral stance. While we're in a unique space where it is easier to appear good than it is to do good, social media allows us to bandwagon on a cause or associate ourselves with a particular group